So good morning, good afternoon, good evening, everyone, depending on what part of the world you're joining us from. We're so excited to welcome everyone to our webinar titled Weathering the Storm, the Impact of Climate Change on Vulnerable Women and Children, which excitedly, it's first of our global health, Crossroads and Global Health series. Today's topic is pretty much what, a lot of us have been hearing in recent times. The global health community is talking a lot about climate change. So we aim to shed some light on the crucial intersection between climate and health, particularly focusing on women and children who we know are often the most affected by environmental changes and other things. So the WHO, like we know, has recognized climate change as one of the greatest threats to global health. And according to the United Nations Development Program, we're seeing that women and children are 14 times more likely than men to die in natural disasters. With women, of course, suffering disproportionately during climate crisis. So we see how important it is, to talk about these things. We're also seeing a lot of other issues across regions where we work on how climate change is affecting women and children, from displacement and migration to food security and nutrition issues, to other health implications, including morbidities and mortalities, and very importantly, gender-based violence. Importantly as well, we're seeing extreme weather events, rising temperatures, shifting disease patterns. We're seeing more vector-borne diseases, which are creating new challenges and also exacerbating existing ones. So this makes it really crucial for us, not just to understand, but also to address these impacts across our programs. I would also want to note that very recently, Project Hope worked with Deloitte on a white paper, which was really focused on the impact of climate change on the health workforce. And this is set to be released in the coming weeks. So I would encourage us to watch this space. I will be very happy to share. So today, just so that we don't take too much time on the intros, we'll just dive right in and introduce our distinguished speakers who are representing Southeast Asia, Africa, and Europe, who have graced us with their presence today and would be bringing valuable insights from their respective fields and context. I would start by introducing our co-host, Diana Hammer. Diana is the Director for Climate and Crisis Preparedness at the National Network of Public Health Institutes. She's here with us as co-host, and we're excited to have her set the scene in the next few minutes. And we also have our moderator, Nabila Purno, a program analyst with UNFPA, focused on maternal health. Hi, Nabila. Thank you so much. She's joining us from Bangladesh. And we have our very own only male speaker, who's certainly a strong advocate for women and children, Dr. James Duah. He's the Deputy Executive Director for Christian Health Association of Ghana. He'll be representing the health system, and yeah, we're very excited to have him here. We've worked with him on a couple projects, and we also have Arafin Happy Mim, who's a midwife with the Research Training and Management International, also in Bangladesh, representing frontline workers. Bangladesh, of course, is also very important to us because very recently we've seen a lot of cyclones, flooding, and climate crisis. So we're excited to hear from her how this has impacted her work, especially as relates to women and children. And then lastly, we have Giulia Gasparri, who works with the WHO's Partnership for Maternal, Newborn and Child Health, PMNCH, based in Switzerland, and she will be representing the Policy Advocacy Group. So thank you so much, everyone, for being part of this webinar. Just also to note that at Project Hope, we do recognize the critical link between climate change and health, and are very committed to integrating climate responsive strategies across our programs, including MNCH, infectious diseases, non-communicable diseases, just to ensure that our response is impactful and also holistic. So today's session is not about just understanding the challenges, but also inspiring action and collaboration. And so would encourage our participants to engage, ask questions, think about how we can collectively work together towards building healthier, more resilient future, especially for women and children. So we'll just go straight into our sessions. Before that, I'll have Diana set the scene for us, and then she would hand over to the moderator and we can have a go at it. We're trying to save enough time for questions and conversations after all of the talk. So thank you so much, everyone, for joining, and over to you, Diana.
Thank you. Good morning, everybody. I am honored to join these panelists today to talk about the impact of climate change on women and children. And I'd like to give a brief introduction into this topic. So the effects of global warming on local climate are varied between regions and countries. And even though we know that the human health impacts associated with increased temperatures are mostly being felt right now in urban areas and tropical regions, all populations on Earth are or will be directly affected by the changes in climate. So when we talk about climate change, I'd like to highlight that the planet is warmer and the climate has changed. So whether we speak in terms of extreme weather events, or we use terms like unprecedented heat or record-breaking precipitation, we are talking about climate change already, and we're not preparing for it anymore, but we're responding to it. And this is an important distinction because populations across the world who are already experiencing the impact, the ones who are mostly affected are people living in poverty, people in unsafe housing or poor sanitation conditions, people with poor health status, or those who don't have access to a good health system, or places that have very weak health systems, as well as places with political and financial instability. These people, regardless of the country that they're in, are already carrying the burden of climate-sensitive health outcomes, and that's here in the US and Europe and every country abroad. So within these populations, whether they're being affected right now or not, the most vulnerable populations within every country are going to be pregnant women, the developing fetus, and young children. They're the ones who are being mostly impacted by climate change. And climate change can influence maternal and child health by directly impacting food security and food accessibility, reducing the availability of safe drinking water, pushing people to migrate and lose their social networks, and decreasing the availability of shelter and causing financial instability as well. And moreover, it increases the morbidity for both physical and mental health conditions. And these, as we know, can lead to immediate harm, especially during an extreme event or in the immediate aftermath of these. But what we don't talk as much is about the lasting effects of experiencing unstable conditions or traumatic events, and what that does to young children as they develop into adults. And this is important to talk about when we talk about climate change, or when we're looking for funding, or when we are doing advocacy, because especially we're in politically charged environments where a lot of these words are still not embraced as facts. We can talk that there is a growing body of research that does demonstrate that a lack of perceived security or safety in early years of childhood development, like those you would face when you're experiencing an extreme heat event, or your whole life is uprooted in the aftermath of a climate disaster, can increase the likelihood of developing mood disorders like depression and anxiety, can increase the risk for impulsive behavior and violence, and can also lead to many more adolescents and adults with chronic conditions like hypertension and diabetes. Meaning that the mother and children that are impacted today can lead to adolescents and adults with poor health status who are less resilient to weather any type of crisis in 5-10 years down the road. So as we learned today about global initiatives such as WASH or the Millennium Development Goals, or as we hear about boots on the ground initiatives to provide obstetric care during emergencies, I'd like to invite you to think about these direct actions to promote mothers and safeguard their children as contributing to the climate resilient communities of the future. And conversely, any inaction in this space has drastic consequences on mothers and children now, but it also results in unstable, unhealthy, and unprotected communities in the short and long-term future. So it's my pleasure now to hand over the stage to Nabila and get this interesting conversation going.
Thank you so much, Diana. First of all, welcome everyone. We hope you have a very insightful session on climate change and health, particularly as it impacts women and children. Big thanks to Project Hope for organizing this, very timely. Before we start off with the questions, I just want to take a moment and say how well Diana has set the stage in discussing, why climate change is such an important issue. Climate justice is a feminist justice issue, just because of the power imbalances of how the impacts are being felt. And these power imbalances are not only between the countries, the countries which are producing carbon, but which are being mostly impacted, but also within countries, how different segments of the society can adapt, and how different society, different segments in the society are impacted by climate change. But in addition, it's also a problem within the household and within family units, how different family members are able to cope and adapt to the different ways they're being impacted. And we all know that women and children are a particularly vulnerable group. So it's very important that when we look at this issue, it's only right to start with this, two most vulnerable population groups. With that, I would like to, have the first question to our first speaker, Arifin Meme. So Arifin is a midwife. She works in Bangladesh. So Arifin, can you please tell us what are the main vulnerabilities that you see women and children are facing due to climate change? And how do you think this is affecting mothers and children's health and well-being?
Thank you so much. I think at first I really want to indicate some common climate change, especially I have experienced, and if I talk over through your question, these are cyclone, heavy rain, and heat waves, which are common in Bangladesh, and I have personally experienced these of things very closely. And in person, I am engaged with such of a system where we work hardly to prevent any kind of conflict and emergency situation. So we often found high anxiety among pregnant women about transportation and emergency medical access. It's about always what if any complication arise, and what if they need emergency medical support. So this is like fear of not being prioritized, or not get access in the hospital at the right time. So I just want to focus on some points, like during, as I already mentioned, that during heavy rain with such of strong winds, and also when any cyclone hits, like it's impossible to move or make any refer of emergency cases from the land to the mainland. And we are actually, as a midwives, we are managing every complication, especially providing the BMOM services successfully during heavy rain with strong winds. I really want to mention that in my past 2.5 years, I have experienced 3 to 4 cyclones, and most of the time we are facing like electricity problem with such of vulnerabilities, and we actually don't see like the sunlight for 10 to 14 days during this situation. And I really want to explain such of my experience. Like I remember during heavy rain and strong winds, we had an emergency case in our primary healthcare center, and it was a large baby due to diabetes mellitus, and that time we couldn't refer that women to the CMOM facility due to strong winds and heavy rain. And with very sad news that the outcome was stillbirth, and it was a bad incident of my experience. So I really want to mention that the transportation is the biggest concern here. And I really want to mention the another topic, that is during this duration of cyclone, we are often receiving like gender-based violence cases more than normal days. And I really want to mention here that like how heat waves and heat stress are giving impact on pregnancy and the women's life during bearing the child. So during antenatal checkup, what we often found that maximum pregnant women experiencing hypotension, and we are facing that the increased temperature, like in some of the month in Bangladesh, like heat is over the head, and that actually giving effect, and with we are observing the pregnant women and with severe sweating observed. And in the Bimong facility where midwives are providing the main services, we actually found that 7 out of 10 pregnancy, if we count the outcome, we got low birth weight, and also beside of that the premature delivery and stillbirth, and and the premature delivery and stillbirth are common outcomes, and with the low birth weight. So I think if we talk about experience and the situation, if I highlight one incident, we received a patient like in our health post, and the mother was not in labor, but when we were about to giving antenatal checkup, we found that a fetal distress, the fetal heart rate was more than 170. So immediately we referred that patient to the CMOM facility, and there the midwives and the other healthcare providers like gynecologists diagnosed severe fetal distress due to like dehydration. So as a midwife, we don't promote counseling on cesarean section until it's a life-saving procedure. So that time we counsel that women to have a cesarean section to save her baby's life. So these are the common situation, like heat stress and like hypertension, dehydration, and some transportation challenge and electricity challenge. These are things are really connected to the climate change and during this emergency situation. And I think if I don't relate the mental situation with this topic, I think it will be not great, because mental situation is really connected to the climate change, both from the side of the community and the healthcare providers. And what a mental health of ourselves hits like when during a flood or cyclone, we are in a food crisis also. I think these are the topics are really connected and related to the climate change, and we can highlight the topics as the vulnerabilities in Bangladesh.
Thank you very much, Meme. I think, hearing firsthand from you, a healthcare provider working in such a climate vulnerable region, seeing patients and women coming with their vulnerabilities, with the challenges that they're facing, I think it's very important, and it really does set the stage. So this brings us to a different segment of our discussion right now. So we heard some of the challenges that women, the population groups, they're facing right now because of climate change. Be that extreme weather events, be that slow onset issues, and how it challenges their accessibility to healthcare services. At the same time, I think from the healthcare providers, from the health system's perspective, climate change again is a very multi-sectoral problem, right? Because it has impacts which are direct and indirect, impacts which are short-term and long-term, and it depends on the front line healthcare workers who are dealing with women and children populations day in and out to be able to realize which impacts are being caused by climate change and how best they're suited to help the communities. With this, I think we will have a lot of great insight from Dr. James Duah, who again is the Deputy Executive Director from the Christian Association of Ghana. Dr. James Duah, I welcome you to give us some insight about some of the problems related to RMNCH that women and children are presenting with, in the healthcare facilities in Ghana due to climate change. And what do you see as the role of healthcare providers in identifying and addressing these impacts while dealing with the women?
Right. Thank you very much for the opportunity to speak on this issue. I think Diana has set the stage, enumerating all the key areas that climate presents globally. Let me say that the Christian Health Association of Ghana is the second largest provider of health services in Ghana. And we've actually been, we present strong response to climate-related issues because of our direct relations in terms of health services delivery in Ghana. The main climate situations in Ghana mainly are erratic rainfall, number one. The second has to do with water spillages. If you have been following the news on Ghana, I'm sure you may have read about our recent water spillage from the biggest dam that we have in Ghana. The third one has to do with drought situations, higher temperatures, and rising sea levels. Now, how do these impact on women and children who access our health services? I'll classify this into 6 main areas. Number one is access to services and nutrition. We operate mainly in rural areas. So in some of these areas, when they are floods, as occurred recently, you have several communities that are cut off from main service delivery point. When this happens, women who are accessing prenatal care services, reproductive health services, including family planning, contraception, safe childhood services, are not able to. It's quite common in the places that we operate. Again, disasters like flooding usually also affect children and women, and it increases the number of emergency cases, especially for women who are not able to flee. In September 2023, we had a situation when the biggest dam, Bakosombo, the capacity was exceeded. And so we had very high levels. And so the dam authorities had to release the water. And it affected several communities. 26,000 people were affected. These people had to leave their communities. And you know, in situations when people are running for their lives, mothers are often affected. So it increased a lot of emergency situations. The third one in terms of access actually has to do with immunization programs. We are set up to take services to communities, to the doorstep of communities. As WHO recommends about primary healthcare services, mostly that is what we do. So when there are floods, we are not able to take key services like immunization, where we give vaccines to children to prevent childhood killer diseases. Again, we also have issues of access to nutrition. If you look at Ghana, we have 16 administrative regions. 5 of the regions are set up in the north. These are very poor regions, and they are affected by very extreme weather, especially drought and hot temperatures. And during this time, it's actually about 8 months out of the year. You have four months where it rains and 8 good months where the weather conditions are very, very, very harsh. And these negatively impact on crop yields. At this point, food stuff become very expensive. And because those regions are very poor, most people living on less than $2 a day, they are unable to afford food. Or even when people have money to be able to buy, they are not able to access it. So what happens? You have high malnutrition rates, stunting for children, and even for women, you have pregnancy with malnutrition, which undoubtedly leads to having babies with low birth weight. The second area is actually on infrastructure. When floods happen, as occurred recently, you have strain on health infrastructure. The spillage of the Akosombo Dam actually submerged a lot of our facilities where so many people access health services. Recently, in December as well, apart from the Akosombo Dam, you had another spillage from the Bagri Dam, which is coming all the way from Cote d'Ivoire, Burkina, also affecting 2,000 people and 43 communities who had to flee. The health facilities over there were also submerged underwater. And so during those periods, all people who had to access health services were not able to. There's also impact on maternal mortality. If you look at our data, the commonest cause of maternal mortality is actually hemorrhage. The second commonest cause is preeclampsia, eclampsia. And as you are aware, these are mostly impacted by high temperatures. So in regions where you have high temperatures, preeclampsia, eclampsia conditions are quite common. Now, because a lot of the months in Ghana are also high temperature months,
We will probably need to move on to the next question, and then we really want to hear this, and we hope we can elaborate more on this in the next session. But please, if you can just wrap up the question, that will be great. Thank you.
All right. So the high temperatures and drought situations also has diminished electricity production, and so we have invested quite a lot in solar. But what we have realized recently is that, unlike before, rainfall patterns are changing. So where solar systems for health facilities used to work well, now because of increased rain, the solar systems are not working. So you have a situation where midwives have resorted to using torchlight to provide care. All these impact on health services. I think I'll end here for the next speaker. Thank you very much.
Thank you so much. And, we'll in the next round, we'll be hearing more about this experiences that you have. And with this, I think now we want to listen to more about at the policy level, what's going on that support healthcare providers to respond to the impacts of climate change. And I want to request Giulia Gasparri, who's a technical officer with the Partnership for Maternal, Newborn, and Child Health. So Giulia, can you please tell us a little bit about what policy and advocacy efforts are in place to protect mothers and children's health from climate change?
Thanks so much, Nabila, and thank you again to Project Hope for the invitation. So building on the interventions by the other esteemed panelists, we have heard that climate change impacts disproportionately women, children, and also adolescents and young people. However, when we look at policies, actually, the current data shows that climate policies specifically are not really prioritizing the needs of women, newborns, children, and adolescents. For example, when we look at nationally determined contributions, which are countries' commitments towards the United Nations Framework Convention on Climate Change and the Paris Agreement, UNICEF has analyzed that out of 103 countries which submitted new nationally determined contributions in 2021, only 34% really were child sensitive. At the same time, UNFPA, and I know some of you here might know this, has recently launched their report on analyzing sexual, reproductive, maternal, and newborn and child health in nationally determined contributions, analyzing over 119 NDCs from 2020 to 2022. And it shows that only 38 countries reference specifically SRM and CAH. I'll give some country examples to show that it's not all doom and gloom, using some of the countries that we have mentioned so far. So looking at Bangladesh, for example, Bangladesh does include it in its nationally determined contributions, some planned activities specifically on promoting low carbon and clean cook stoves to reduce really indoor air pollution. As we know, indoor air pollution from unclean cook stove is one of the main causes of increased asthma and respiratory diseases for women and children, given that they spend more time at home and are responsible for the cooking most of the times. Bangladesh also mentions in its NDC also the importance of engaging young people in climate action. Looking at Ghana, Ghana has prioritized in its NDC promoting gender responsible sustainable forest management, so including women in this field as part of a climate response, and also managing gender related health risks, aiming to have interventions that can benefit most of the population. There's other countries which I won't mention now, but for example, like Paraguay has in its NDC the the intention of building capacities for family health units. In Venezuela, their NDC includes also the integration of SRHR, information and awareness in the context of climate change. So overall, there are countries who are increasing their policies on this intersection. However, policies are not enough. We need to ensure that the activities and policies are actually accompanied by financing in order to ensure that then the interventions are implemented. When we look at climate financing, overall, the data shows that only 5% of climate adaptation spending overall worldwide is dedicated to health. And only 2.4% of climate financing from multilateral climate funds is actually targeted to child responsive activities. So this is a very small proportion, and we really need to ensure that we can increase financing, both in terms of exploring synergies between health financing and climate financing, and exploring potentials for co-financing. So co-financing is when we use funding from one sector to support the goals of another sector. Although, as I mentioned, in terms of policies, there are improvements in the field, but still women, children, adolescent health are not really prioritized in climate policies. When we look at advocacy, on the other hand, we see that worldwide there's a growing movement, specifically from the climate and health community, and also from adolescents and young people themselves, towards calling for more policies, more financing, and more services for prioritizing women, children, adolescent health in the climate crisis. So we can talk about this more later, but it's really, powerful to see that there's this growing movement calling for more policies and financing.
Thanks so much. Yeah, I think, it's very important to understand the machineries at the policy level that trickles down to what actually happens with the health system. That's great. With this, we are now going to move on to round two, where we talk a little bit more about solutions. So I would now again go back to Arafin, and I want to ask you discussed some of the unique challenges that women in your community, they're facing related to maternal health issues and accessibility issues. Can you talk a little bit about solutions? And we would want to do this within 2 minutes if possible. Over to you.
Ma'am, you're on mute if that's if you're speaking.
Right. I think is having some technical difficulties. I think we can. Are you able to hear us? Okay, so we will move on to James, and then we can come back to when she's ready to speak. So to Dr. James Duah. So I wanted to ask you, in your setting, how can you ensure meaningful participation of, women? How do you ensure meaningful participation of women in this climate change adaptation initiatives that goes on?
Thank you very much. I think it all begins with education. And in Ghana, we understand the concept of involving women very well. One of our former ministers has said clearly that educating a woman means potentially educating a whole nation, because they manage the home. Even those in management have wider reach. Women are listened to quite clearly. So for us, that is where it begins with educating the women, so that one, they can start from the home, they can start from the offices. That's quite important. The issue of creating national awareness, awareness on potential effect of these, how to be involved, responding through emergencies, either through the religious groups or leaders or whoever it is. That's also quite important. We've done some work with Project Hope on mental health, and I think that is about training the health workers who are the forefront of care in times of crisis that climate presents, how to be resilient in such situations. So health worker education and training to be resilient is another very important point. This year, when the midwives celebrated their International Day of the Midwife, one of the things that we brought to the fore is actually on tree planting, considering that 5 main regions of this country are subjected to harmattan and very severe weather conditions, especially high temperatures, given the sparse land with no trees. One of the things that we are doing is actually women and midwives leading tree planting across the country. There's other issue of providing resources. There are places where we cannot avoid flooding. There are places where we cannot avoid the high temperature. So what are we doing? With support from partners, we provide resources that are needed to take services despite these situations to the community level using the primary healthcare approach. So we buy things like motorbikes, we use raincoats, water boots, and things so that midwives and nurses can deliver care. In terms of quality of care, not to be affected by electricity challenges that we are experiencing. As I mentioned earlier, we are investing in solar energies so that places where we have enough sunlight can have on can have adequate electricity to provide the necessary care, especially for prenatal care, postnatal care. Again, for the northern side, one of the things that we are doing is providing health workers decent accommodation. If you have hard weather, high temperatures where people cannot sleep at night or sleep during the daytime because of high temperatures, providing decent accommodation, air conditioners is very important. I didn't mention about fire.
James, thank you. Sorry. Again, I think it will be great if you can please wrap up in 30 seconds. Thank you.
Yes. So in places where they are susceptible to fire, we are also constructing fire belts around health facilities to reduce vulnerabilities that occur with infrastructure to fire. Thank you very much.
Thank you very much, Dr. James Duah. Now, again, Meme, if you're able to hear us, are you there?
Yeah, I can hear you.
Great.
Sorry for the inconvenience.
No worries. In very short 2 minutes, can you please talk about some of the solutions, that you have been engaging in for climate change issues on maternal health?
Yeah, I think rather than the solution, I can connect the prevention and solution in together because, as a midwife, we are personally, I believe that what we can do with our words and our hands, rather than the technology and the modern things, and we are going forward to the counseling part and the better counseling during the antenatal checkup. But if we can see the context of Bangladesh, I think counseling part and what we can do with our words, and this is the I think this is one kind of ignorable topics because we need to talk more with the women about the situation and the condition, and we need to make her understand about the impact of what can impact and the affecting situation, and how can she move to the right safest side, like counseling about the importance of keeping her hydrated, how can she keep herself cooler. And beside of that, we are also collaborating with the system, how we can make her safe during the situation. If I talk about the collaborating work between the community health and nutrition workers, and they are going to the door to door and counseling the pregnant women and the children and the facility, and the midwives are making collaboratively working and making list of pregnant women, children, and old people and disabled peoples also, to help them during any climate change hits. And we are actually also supporting support of a higher management team, and we made emergency support team, and that referral center we are keeping in our mind to referral center for individual area for casualty management of I think patient at the time of disaster. So ensure which organization will give ambulance support, the transportation support, and how we can cope up with the emergency situation. So we made an advocacy for the better transportation to move to the mainland. And in my working place, I think the result of this advocacy is like sea ambulance. It is just an example to looking forward the achievement. And we are actually also prepare ourselves during this crisis with the emergency kit boxes and the ready to the solar system. As I already mentioned that we don't see the sunlight for 10 to 14 days during this situation. So I think we need to be ready with the solar system equipment and to do normal vaginal delivery and managing all the complications, and keep available of essential medicines also. I think this from the counseling part to the preparedness and to communicate and advocate to the high level management team, I think these can make a perfect solution or prevention ways to during the climate change hits. Thank you.
Thank you very much, Meme. We can see the picture, and it really does tell the story of how services are provided in extreme weather events. How local solutions are actually the key. Great. With that, my next question is for Giulia. So Giulia, can you please tell us a little bit about recommendations for fostering interdisciplinary climate change initiatives and policies that protect, women and children?
Yeah, thank you so much for that question. And I think we've heard from all the other panelists the importance of, the intersection between, climate change, for example, how it affects transportation, it affects nutrition, it affects violence, and how that has a repercussion on women and children's health. So it's clear that in order to really address these issues, we really need an interdisciplinary approach, which really integrate the inputs also from experts from different sectors. Some of the main barriers that we are facing in terms of addressing the impacts of climate change on women, children, and adolescent health are the siloed policy making, the siloed financing and budgeting, and need to foster interdisciplinary action in this field. And some of the ways I think that is important to do this is through the power of partnership and multi-stakeholder platforms, bringing partners together from different fields, really to align on messaging, align on evidence, and also provide capacity building for experts from different fields. And there's many initiatives that are doing this. For example, the Global Climate and Health Alliance, bringing together climate and health organizations and experts. Within that, there's also the Youth Climate and Health Network, in which I'm a part of, and we are really trying to advance this intersectoral action moving forward. At the same time, there is an importance really of ensuring, capacity building on these issues, because climate experts might not necessarily be aware of the unique needs of women and children, and therefore regarding specifically their health. And at the same time, health experts are not necessarily aware of what is climate change. And therefore, it's really important to ensure capacity building and really engaging people from different networks through multi-stakeholder platforms. At the Partnership for Maternal, Newborn and Child Health, we are doing this capacity building effort, bringing together partners to really advance these issues. And in order to do so, we have been aligning on messages, specifically advocacy messages for our different constituencies, from NGOs to private sector, youth-led organizations, UN agencies, funders and donors, governments, because we all have a part to play. Each organization has a part to play in order to advance this intersectoral action. And so part of the advocacy messages that are really tailored to each and every single constituency is, however, to ensure that, for example, we advocate for women, children, and adolescent health to be prioritized in climate policies, and vice versa for health policies to really address the issue of climate change. We need to also ensure, for example, adaptive social protection, which ensures that women and children can cope with climate shocks, ensuring that they have the finances in order to cope with these shocks. And this is an example of an intersectoral initiative that can be promoted. We also need to ensure really the importance of community engagement and really engaging with women and children children who are the most affected, but who also have the solutions and are coming with very strong advocacy messages, and specifically adolescents and young people who around the world are really driving climate advocacy and engaging with them in order to understand their priorities, and their solutions moving forward, so that we can ensure a really multi-sectoral approach towards addressing this issue.
Great. Thank you so much, Giulia. I like how you have already touched on the issues of, community engagement and how different providers can be trained and what are the different ways all of the multi-sectoral players in the climate change and health arena can be brought together. That's great. With this, we are going to go into our question and answer sessions. If any of you have any questions, please do put them up in the chat. We have a couple of questions. So I would like to start with the first question. And this first question is for Meme. So Meme, if you can tell us, in your perspective, just 2 priority actions that can be taken to make women in Bangladesh more resilient. 2 actions, priority actions that can be taken.
Okay. So I think in this question regarding, I think I can talk about the infrastructure of the facility where midwives need to be that need to be maintained the privacy and within the hospital towards the mother and their to maintain their privacy in the maternity part. For giving quality maternity care, we need to be think about their privacy, about the space. The just one labor room cannot be justified their whole labor time, because it's a huge time. It's about 10 to 12 hours. We need to be stay with the mothers. I think the hospital infrastructure is one kind of thing, and the another thing is I've already mentioned the transportation to in the right time where we need to be sent or the refer to the mother to save the babies and the mother's life in together. Thank you.
Thank you very much, Meme. This goes to the heart of the community itself. Women in their cultural context need to feel protected, need to feel that they can come to the health facilities in a safe way and have respectful care. So it's also a human rights issue here. Great. Thank you so much, Meme. We have a question for Giulia in the chat. I'm just trying to access the question. Great. So it's from Stephen Neri. And the question is, Giulia, if you can please tell us some details about the Youth Climate and Health Network so that they, people can connect to the network.
Yeah, thank you so much. And I'll also just drop the link in the chat where you can find more information. But essentially, so the Youth Climate and Health Network is a youth-led network hosted by the Global Climate and Health Alliance, and it was founded in May 2023 to really bring together young people, specifically from the health sector, the climate sector, but also any other sector who want to really be engaged in this intersection, really to drive forward climate justice and intergenerational justice. So looking specifically at the impact of the disproportionate impacts of climate change on young people and future generations from a health perspective, and really to push forward for this intersection. The main purpose of the network is really to ensure that different organizations and different individuals can really connect with each other in order to align more strongly for more powerful advocacy. And we have initiatives running throughout the year, specifically, for example, at the UNFPA COPs, at WHA, the World Health Assembly, but also in other regional big conferences or national conferences where the members of the network really come together in order to align on advocacy messaging, reaching out to governments, for example, to call for specific issues, and supporting specific campaigns, such as, for example, the Fossil Fuel Non-Proliferation Treaty calling for the phase out of fossil fuels, and also other initiatives. So if you want to hear more about it, I've dropped the link in the chat, and or you can reach out to me also for further information. I hope this is useful.
Great. Thanks so much, Giulia. I think that's great. There's the link in the chat box for people who want to access it. We have another question for Dr. James Duah. So, Dr. Duah, if you can recommend how to address the delays in accessing MNH services related to flooding in Ghana, better transport or decentralized services, what do you think is the way to go?
I think it requires both because context differs in some of the regions. And so there are places where even a few decentralized services, staff may not be able to live in such communities. And so in such areas, it is good to package the services, provide adequate transportation for staff to be able to get there. And then, I mean, there are also areas where you need to also provide means for the women to be able to. I think anticipation and preparedness is quite important. Educating families to know that within these periods, these are likely to happen. And then the third thing that I would say is actually intersectorial collaboration. In the two disasters that happened recently, September and December, we saw disjointed response from the National Disaster Management Organization, from our facilities, from the clergy, different responses. And so where we work together to provide coordinated response, I think it works better and we achieve better effect than if it is disjointed. Thank you very much.
Great. Thank you so much, Dr. Duah. I have one more question for you. Given your wide expertise working with all these healthcare providers, what do you think are the important skills that healthcare providers need to learn to be able to respond to climate change?
Thank you. So let me draw on the experience that we have, a shared experience with Project Hope. During the COVID crisis, we had assumed that health workers know a lot. And so there were a group of people that were left. And so we packaged training on resilience to COVID response. And you'll be amazed what we saw during the training. And I think that we need to do same when it comes to climate change. What is in the mind, the eye will always see it. What is not in the mind, the eye will never see it, even when it is very close. And I think we need to drum the issue of climate change, how it occurs, and some of the impact to health workers so that we can prepare. The issues of disaster always happen around certain periodic times. Staff need to be involved and know how to prepare. The issues of temperatures, very high temperatures and its impact on, let's say, eclampsia, pre-eclampsia, all these we can create awareness for health workers to be aware and involved. Thank you.
Thanks a lot, Dr. Duah. And as a program manager for health in Bangladesh, I wholeheartedly agree with you. Even if we lack evidences about a lot of the ways into how climate change is impacting specific health outcomes, it's so important to orient healthcare providers that climate change is a real issue. They may experience it, they may not be able to draw linkages, but it's so important to already start orienting them, sensitizing them about these issues, and let them take the lead and to join and to connect the dots, what it is that they're experiencing in their communities. We, like in Bangladesh, we are doing a lot of work like this, and we are seeing that healthcare providers, when they are being sensitized to different climate change issues, they themselves are able to pick up the ways it's impacting women and children and communities, and what it is that they can do to safeguard community health going forward. So it's been a great honor to moderate this discussion. We have heard about how communities are vulnerable, but how they would like to become resilient, how the different healthcare providers, different facilities, what are the ways that they can become resilient, be that through natural or local initiatives, through trainings, through sensitization, and how, more importantly, at the global level, there are so many platforms, there are so many tools like the NDCs, the National Adaptation Plans, the Health National Adaptation Plans, which provides the opportunity for all of us advocates for health to say that climate change is impacting health, and how we'd like to see this movement going forward. With this, I would like to hand it over to Dr. Uche to speak a few closing remarks. Thank you, Dr. Uche. Over to you.
Thank you so much, Nabila, and thank you so much to the incredible team of speakers. Thank you for sharing your insights, your experiences. We're really deeply grateful for all of what we've learned. And for me, I would say this was very insightful. A lot of highlights showing how profoundly climate change is not just impacting health, but women and children, specifically, and the examples from Ghana, from Bangladesh. I think very importantly is also what we're hearing from the policy side of things. I think one key takeaway for me, I think I took a couple notes around one, multi-sectoral and interdisciplinary approaches and collaboration, right? We can't do this alone. We need to collaborate. We need to partner. We need to also listen to the communities and know what they want. We need to engage even with the women and let their voices be heard. We want the women also to be part of the solution. So things around creating awareness, trainings, and a lot of things that are already ongoing in countries. I also like the angle of engaging with young people and the advocacy group Giulia alluded to, and I think we want to continue to engage in these conversations. So we've heard a lot about the critical work being done on the ground, the systemic challenges faced by health systems, and a lot of the global policy efforts. We're not there yet. We need to go beyond policy to actually financing. And some of the outcomes from the COPs from last year and hopefully for this year, we're seeing more investments in climate and health. And we're hoping, we can all leverage and, improve resilience in communities where we work. So let's all take insights and inspiration from today's discussion. And I think for me, it's, turning all of that into concrete actions. So my call to action would be, let's continue the dialogue. Let's continue to advocate for policies and practices to protect the health of the most vulnerable. So once again, I thank you all, our participants, our speakers, our co-hosts, for being part of our first Crossroads in Global Health seminar, Weathering the Storm. Together, we hope we can make a significant impact in the fight against climate change and health. And we look forward to seeing you all at our future sessions and continuing this very important work we all do together. So have a great day and stay safe and healthy. Thank you.